Time to get outside, but before we do, a blepharoplasty can awaken your look. I actually had one a few months back with Utah Facial Plastics. Joining me now to share more in the sponsored interview is one of the surgeons, Dr. Doug Henstrom. Welcome back to the show.
Thanks, Ray. It's great to be back.
You're like family.
That's right. We love coming here.
We trust our faces with you.
That's a heavy trust that we take very seriously.
Okay, so let's talk about the bleph and what exactly it is and how it can change your life.
So a blepharoplasty is any kind of eyelid surgery, whether it's your upper eyelids, your lower eyelids. And so we're seeing so many people come in with complaints about heavy eyelids. They feel like they look very tired, worn down, but they don't feel that way. And it's the eyes that kind of give it away. So we're seeing more and more patients wanting eyelid surgery.
I had the upper bleph done, and as you age, your lids kind of just droop a little bit or a lot. And I had a line, I had a crease, and I went to Dr. Thompson. I said, can you please do it? And he said, no, I'm not going to do it because the Asian eyes, they're tricky. And then I convinced him. And he did an amazing job.
Of course.
And I'm so glad. I wish I got it done earlier.
Well, that's what we hear from a lot of patients is this is something, it's one of the highest patient satisfaction procedures that we do. It's easy to do. We can do it in the office. Here's an example of a lower blepharoplasty on this patient, getting rid of some of those heavy fat bags underneath the eyes, as well as actually putting in a little fat into the cheeks to give us a good rounded eyelid to cheek complex. So it restores youthfulness to the eyelids. It gives you a better look. It speaks volumes, and it does so much for people's confidence in how they look and feel. Here's just an upper blepharoplasty that you can see from the side. What we're trying to do is uncover that eyelid that is now hidden under that extra skin that's fallen down and gotten loose as we age. So just removing a little bit or even a lot in some cases can go a long ways towards making an eye more youthful. This is dramatic right here. Yeah, and so people feel so much better. Their eyes will open up more. They'll tell us they feel like they're getting more light. This is actually a brow lift instead of a blepharoplasty. So sometimes when patients come in, we've got to have a discussion is it the eyelid skin or is it the heavy brow that's coming down that's causing that heavy upper eyelid look? And in this case, it was a brow that was too far down. So we did a brow lift on her. You can just see how much more her eyes are open. Well, that's a good point, because the consultation is important. You think one thing and it might be another. Yeah. And I say the befores and afters, it takes 10 years. You look 10 years younger. Yeah. It takes away those years, and I think it's such a dramatic difference, even though you think it's subtle. But imagine waking up and that's how you look. Yeah. Yeah, and the consultation, like you said, is critical. Coming in, speaking with people that know the nuances of the upper eyelid, the brow, the lower eyelid, what are some of the risks that are involved, because it's not a riskless procedure. There are things that we need to do and take account for so that we don't cause any problems for patients. But this is what's so surprising. Some people even go back to work the next day. The downtime is so low. I got my procedure done on a Friday, came back on a Tuesday, but that's because I'm on air. Yeah. But I would have come back on a Monday if I could. Yeah, so the results are going to vary like that for sure. Not everybody can come back as quick as you did, but it's a procedure that we usually do just as far as the upper eyelid is concerned. We can do that with patients awake in the office. You don't have to have a general anesthetic. We can just use local anesthetic so people can get back to doing more normal things really quickly. There is going to be bruising and swelling to heal from, but that can be pretty minimal. I was singing with Dr. Thompson during my surgery. That's how, actually, it was kind of fun to say. I don't know if you can say a lot about surgeries and you can do that, but. Well, we want you to have a great experience. Yes. And if it includes doing some singing while you're there, then we'll let that happen. Okay, and what a great thing that you're offering, Utah Facial Plastics, is giving free consultations for a bleph, and that's a $150 value. So take advantage. Yeah, patients can call in if they mention this segment in our office. They can get the consultation for their blepharoplasty for free. We're anxious to see you. We just want to make sure we treat you right. And you know, voting right now is also going on for the best of SLC, and that's a big deal for us. You can find those categories on our Instagram. You can find a link on our Utah Facial Plastics Instagram to vote for us, and we're defending our 4 years or 5 years running of best cosmetic surgical practices.
Nisha, Dina, and Saray, we all put our confidence in your hands, so that says a lot. And so definitely a vote from us. And so there are a lot of people who also put their confidence in you. Thank you so much, Dr. Henstrom.
Thank you for having me.
Look at all of those locations that you can also get that consultation.
Including the new Heber location.
The new Heber, congratulations. Thank you, Dr. Henstrom, and thanks to Utah Facial Plastics for the sponsored interview.